Hello, my name is Maureen Casey, and today I'm going to talk to you about eliminating mandatory overtime of nurses. Many hospitals use 12-hour shifts as an incentive to recruit and retain nurses. 12-hour shifts allow for more flexible schedules and more days off, usually. But in the 2014 book, Nurses Making Policy from Bedside to Boardroom by Ludwig and Associates, studies noted that nurses are 3 times as likely to make an error when working shifts lasting more than 12.5 hours. Research suggests that mandatory overtime as a solution to staffing shortages in hospitals should be banned because the increase in hours working are directly linked to an increase in nurse injuries and fatigue, as well as poor patient care, such as medication errors. The 2 main points I will cover are that 1, chronic understaffing necessitates a greater need for nurses, and 2, the increased hours and number of shifts lead to an increase in nurse injuries, fatigue, as well as medication errors. Let's look at these 2 points separately. So first, chronic understaffing necessitates a greater need for nurses. In the 2009 article, The Nursing Shortage, a Public Health Issue for All, in the Online Journal of Issues in Nursing, Glazer and Alexandri documented the nursing shortage and predicted it will continue to increase through 2020. Later in 2012, an article entitled U.S. Nurses Overworked, Underpaid, and in Demand, in an issue of an Australian journal, The Queensland Nurse, it was predicted the need for nurses in the U.S. will grow by 26% in 2020, by 2020. That's just 5 years away. The second point is that an increase in hours and the number of shifts lead to an increase in nurse injuries and fatigue, as well as medication errors. This happens because nurses are typically working 8 to 12-hour shifts and are increasingly needed to stay longer or come in on their days off. Bay and Fabry in 2014 compiled data in an article for Nursing Outlook entitled Assessing the Relationships Between Nurse Work Hours and Overtime and Patient Outcomes to document this trend. Scott and his associates in another 2014 article entitled The Association of Sleep and Fatigue with Decision Regret Among Critical Care Nurses for the American Journal of Critical Care found that nurses working more days or longer hours with less downtime between shifts suffered from increased fatigue, which is associated with reduced reaction time and poor decision-making abilities. So, as you can see in this picture that was included in the CEU authored by James Allard for the American Nurses Association, Fighting Fatigue, Improving Your Health for You and Your Patient, this is your brain on tired. The frontal lobe, the dark orange area, is responsible for reasoning, planning, and problem solving. When tired, these abilities become impaired. The parietal lobe, the lighter orange area, is responsible for orientation, recognition, and perception. When tired, comprehension is reduced. The temporal lobe, the pink area here, is associated with perception and recognition of auditory stimuli as well as memory. When tired, it becomes difficult to remember even the most simplest of tasks. The pons, the blue area, is important for the level of consciousness and sleep. When fatigued, it actually becomes more difficult to get adequate restful sleep. So with the tired brain, nurses working overtime are 2 times as likely to suffer injuries such as needle sticks or strains or sprains as those who don't. This was completed in a study conducted by Bay in 2013 article for Nursing Economics entitled The Presence of Nurse Mandatory Overtime Regulations and Nurse Patient Outcomes. Hughes and Clancy in 2008 studied those effects in their AORN journal article entitled Research Linking Nurses' Work Hours to Errors Prompts More State Restrictions, and concluded that nurses working greater than 12.5 consecutive hours have 3 times the risk of making medication errors than nurses who work fewer hours. So the two main points, first, that chronic understaffing necessitates the needs for nurses, and second, that nurse injuries and fatigue, as well as medication errors, occur with increased hours and number of shifts nurses work, lead us to the conclusion that mandatory overtime is not the solution to staffing shortages in hospital. Legislations banning mandatory overtime would help reduce injury and fatigue in the healthcare environment, as well as prevent medication errors. It is important to keep not only our patients safe, but our nurses as well. Thank you.